Hi everyone, and welcome to this video tutorial on how we can apply the behaviourist perspective to health and social care. The aim of this video tutorial is to consider different applications for behaviourist theory in health and social care. So hopefully by the end of this video tutorial you'll be able to explain behaviourism and how it can be used in terms of changing behaviour, and also explain how behaviourism can be used to shape behaviour. So just to recap, we know that the behaviourist perspective is extremely useful in explaining learned behaviours, as we can look at a particular behaviour and trace its origin using concepts of association, things like classical conditioning, reinforcement or punishment, which is operant conditioning. For some people, there may be aspects of everyday life that are simply impossible to cope with. A small boy may be unable to go to school or to the park because he has an overwhelming fear of dogs, which he is likely to encounter in the vicinity of the school or a park. An elderly woman may never leave her home and be isolated and depressed because her agoraphobia, which is fear of going out, is so severe that it dominates her life. Fortunately, as well as explaining the development of phobic behaviours, classical conditioning is also useful in helping to change such behaviours. We can apply the principles of classical conditioning to everyday life in a very practical way. A commonly used method of changing phobic behaviour uses a method of treating acquired fears known as systematic desensitisation. The first stage in this involves creating a hierarchy of fear. Supposing the feared object is hospitals, the individual would create a list of aspects associated with going to the hospital, which may look something like this table. The principle of this procedure is to help a person achieve a state of very deep relaxation. This is based on the assumption that relaxation and anxiety are incompatible. The aim is to replace the anxiety and fear with a state of calm and relaxation. Once the individual is in this state of deep relaxation and calm, an image of the least feared object or situation is shown to the individual, and they are encouraged to relax until they are able to view this without fear or anxiety. This process may take more than one session and may take prolonged periods of treatment. When this level of fear has been satisfactorily overcome, the person moves on to the object or situation at the next level, again working on relaxing until they are able to contemplate the object or situation without a trace of anxiety. Over a period of time, the procedure is repeated until the final, most feared object or situation can be faced without worry. With some treatments, the patient is encouraged to practice some of the lower level fear-inducing situations, for example, opening a letter containing an appointment card or driving as close to the hospital as is tolerable without arousing too much anxiety. The principles of classical conditioning are also used in a common treatment for alcoholism. Individuals are given a drug which, when mixed with alcohol, leads to an extremely unpleasant physiological effects, including nausea and vomiting. The person thus learns to associate alcohol with an aversive rather than deserved response. Behaviorism can also be used in shaping behaviour of individuals. Just as we can learn inappropriate or unhelpful behaviours, so we can use the principles of operant conditioning to create new, more helpful behaviours and eliminate the unhelpful ones. Using the principles of reinforcement and punishment is a very powerful way to change someone's behaviour. This is sometimes called behaviour modification. This technique has been used with autistic children to help them interact socially. Target behaviours such as making eye contact are identified. The child is initially reinforced, i.e. given a reward such as a sweet, for looking in the general area of an adult. Once the behaviour is established, more specific behaviours, such as looking at the adult's face, are reinforced again through reward, until finally the target behaviour of making eye contact is achieved. This is known as shaping behaviour.